I'm Jane Gonzalez. I have a master's degree in education with a specialization in special education. Today, I'll be discussing how to provide aid and comfort for the caregiver and patient during assisted brushing. This is a serious and pressing issue today, affecting millions of Americans, even more around the world. My hope is that through this discussion, we can reflect on key issues and increase awareness and possibly find solutions. Today, we're looking at assisted brushing. This is my mother. She's beautiful, and she has Alzheimer's disease. Keeping her teeth is very important to us because through her smile, she engages with the outside world and receives and gives love. Unfortunately, brushing teeth is not at the top of the list of important tasks to complete in the medical world, especially not in hospitals and institutions. You can see in this graphic how care providers, and in this case nurses, but it could be family caregivers as well, have many demands on their time. In this picture, you can see an overwhelmed nurse running in the hospital with everyone screaming, "Nurse, nurse, nurse." And really the last thing she's thinking about is brushing teeth. And yet, brushing teeth is very important and a very difficult procedure. As a result, brushing a disabled person's teeth is often overlooked. In a recent study by Hensley, Giorgio, Steele, and Valadin, I quote, "The residents who need the most help with oral care often missed out entirely. Staff avoided toothbrushing if residents had swallowing disorders. They also stopped providing oral care if residents were resistant or aggressive, including people with dementia." Let's look at why toothbrushing is so difficult and what it really involves. Dr. Collis has practiced dentistry over 60 years in Minnesota and Texas. He has contributed to the research on assisted brushing techniques.
It didn't take me very long after I started practicing dentistry to realize that my patients just had a terrible time brushing their teeth. There was too much work to do. They didn't have the dexterity or the patience to do it. The tooth has 5 surfaces that need brushing. Each tooth has 4 embrasures where food particles get caught, and each tooth has a sulcus on the outside of the gums, the buccal side, and the